for liver. Okay, चलो start करते हैं. So now first is LFT. quickly करते हैं. LFTs आपको पता है liver function test. What will you test? Simple. Bilirubin direct, conjugated, indirect, unconjugated. You will check for the serum proteins. In the serum proteins, you will check albumin, globulin, and if you want, you can even check fibrinogen. But albumin, globulin ratio is what you are going to check. Now, serum albumin is something which is not going to be absent in the acute phase. It is only affected or decreased when chronic disease is there. It is a most common plasma protein responsible for osmotic pressure. It has smallest size. ये सबको आता है. इसका life होता है 20 days. Fine. Now acute, this I have done with you. Okay. Now next, you must know normal क्या होता है. Go over a LFT report. Normal is around 3.5 or 3.7 depending upon different labs to something like 5. तो 4.7 हम नॉर्मल मानते हैं, मिडल. ओके. एल्ब्यूमिन ग्लोबुलिन रेशो, एल्ब्यूमिन इज 4.7, ग्लोबुलिन इज 2.3. सो बेटा द रेशो इज 1.7:1. This ratio is reversed when there is cirrhosis or there is liver damage. Done? Okay. Next is liver enzyme. So इसमें क्या क्या क्वेश्चन आता है? Albumin. Fine. Then the question will come upon PT also. So PT को यहाँ discuss कर लेते हैं. Right. PT, the prothrombin time. Whenever someone has liver cirrhosis, liver patient, the PT increases. This is very important. Why? Because then we have to give vitamin K injections to a liver cirrhosis patient. Why? Because 2, 7, 9, 10. 7 is affected. 7 is having smallest or least half-life, due to which PT increases. So we have to give vitamin K supplements to a liver patient. Fine. So सबसे पहले ये question आता है, what is the first thing to alter whenever a patient's liver is attacked? So obviously PT बेटे immediately हो जाता है. Fine. Then when it goes into chronicity, we have albumin loss. Okay. Next are the liver enzymes. So you have to know what is ALT, what is AST, SGPT, SGOT. Right. I've told you to remember it as PL. ALT is SGPT. Right. Now ALT is something which is very specific for liver. ALP is present in many areas, liver and bone disorders as well. Right. Now ALP, alkaline phosphatase level, is इसका पे क्वेश्चन आता है on the SAP, normal alkaline phosphatase, increase, decrease. This we have covered in your endocrinology, the parathyroid one. Right, parathyroid notes में I have given you a full table that in hypoparathyroidism, in multiple myeloma, in osteoporosis, SAP or ALP remains normal. ये बेटा क्वेश्चन आता है. Osteomalacia में however what happens? Osteomalacia में what happens to the ALP? Yes बेटे. Osteomalacia में however the SAP or ALP increases. Right. So these 4-5 things you must know and you must do it from the endocrinology chapter. ठीक है. Next. So ALP liver में कहाँ increase होता है? ALP liver में increase हो जाता है whenever there is obstructive jaundice, obstructive liver disease, something to do with the biliary duct. Now GGT. Please remember GGT is the enzyme for acute अल्कोहल इंटॉक्सिकेशन. ठीक है. जब अगर अल्कोहल में कुछ प्रॉब्लम है, इफ somebody is a chronic alcoholic, I am writing it here only, आगे भी आएगा. AST is to ALT ratio is more than 2:1. Right. If 3:1, definitely it is alcoholic liver disease. 2:1 is highly suggestive of alcoholic liver disease. Now question आता है, a patient is chronic alcoholic. Which enzyme? AST, and AST is what? AST is SGOT or PT SGOT. So this enzyme is going to be increased. ठीक है, एक marker की तरह होगा. But if there is a ratio, the ratio should be marked. In the same question they say a chronic alcoholic on a Saturday night had a lot of alcohol. Which enzyme will rise? GGT. क्योंकि GGT जो है it signifies alcoholic liver disease, obstructive disease and more importantly acute intoxication of alcohol. ठीक है, चलो acute intoxication of alcohol में बेटे 2 ही क्वेश्चंस बनते हैं. एक तो GGT और दूसरा बनता है बेटा about the Saturday heart syndrome, holiday heart syndrome, which is the atrial fibrillation. Someone went for a party on a Saturday, 2 o'clock while returning back from the party or the restaurant, he started having fibrillation. Right? So 2 ही questions हैं जो alcohol पे आते हैं. Other आता है thiamine deficiency. Fine. So ये पता होना चाहिए कि which vitamin deficiency is associated with alcohol. Thiamine deficiency. Done? Okay. Next is this chart, magic chart, very important. You must know. In obstructive we know ALP is very very high. Hepatocellular मतलब दोनों ही सब कुछ ही थोड़ा 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 बड़ा होगा, but not on a disproportionate ratio. Fine. Alcoholic liver disease में AST ALT ratio GGT that will be high. So if suppose they give you a question blah 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 written and they give you that ALP is very high, right? If you want you can learn the different values of ALP, AST, ALT. कर भी लोगे तो भी अच्छा है, नहीं करते हो तो भी ठीक है, right? वो इतना वैल्यू देंगे that it will be very high. Like ALP, AST, please remember वो 40, 150 इसी रेंज में होते हैं, right? Like ALP will be around 120 maximum. If it is 500 you will know it is very high. Fine. So beta, if you want to learn you learn, otherwise leave it. Next. Okay, so this I have talked about. PTINR I have done. Okay. Next is about the fat soluble vitamins in a liver patient. So vitamin K, A, D, E, K, all these will be deficient, especially K. Fine. Okay. Next is Wilson's disease. Any doubt in this, everyone? There is an enzyme by the name of glutathione E. Glutathione E जो है, it is post-surgery marker. Right, for the liver post-surgery marker. Then there is 5 nucleotidase that is for metastasis. Right, these are certain questions which might pop up, otherwise they will really roam around the ALT, AST, ALP. Okay, next, Wilson's disease. Wilson's disease is very important. Autosomal recessive. What happens? Copper gets deposited in the liver. ATP7 gene on the chromosome number 13 is defective. So what happens? Temporarily copper serum rises. Transient, temporary. That is why in the MCQs which we discussed, this was the answer which is not seen in Wilson's. Fine. Then ceruloplasmin is a protein which binds to the copper. Copper is excess, ceruloplasmin binds to it. Ceruloplasmin decreases. Okay, so this is very important. There is, because of high copper in the serum for some time, urinary copper increases and copper gets deposited in various organs. Very important beta, one question from Wilson's, hemochromatosis, definitely you will get. Okay, okay. Next is, where does it? बेटा 5 न्यूक्लियोटाइडेज ना मेटास्टेसिस में होता है. सो ऑब्स्ट्रक्टिव अगर मेटास्टेसिस है then it might be. Okay, next, brain. In the brain copper will get deposited. Let me just switch on the fan. That is why I fall ill. I start feeling very hot and then I switch on the fan and then I fall ill. But then what to do? Okay, now let us do in the basal ganglia. If copper is there, we are going to see Parkinson-like symptoms. But beta, all these symptoms, they are reversible. ठीक है ना, तो रिवर्सिबल डिमेंशिया होता है ये. नेक्स्ट, इन द आई वी सी वन सनफ्लावर कैटरैक्ट एंड द KF rings. The case of Lesher rings in the Descemet's membrane, they are brown, gray, green colored, and they are not diagnostic. They are just a characteristic finding. Fine, we see problem in the kidney, recurrent abortion, and even emotional disturbances. Liver is the first organ to be affected, and that is why the gold standard is the liver biopsy with quantitative copper assay. Right? I hope you know this. बेटे liver तो हमें वो क्या कहते हैं, liver तो हमारे खून में है ना. So medicine का तो बेटा हमारे खून में है. And एक चीज़ बेटा ध्यान रखो, आपका पार्ट A है एंड आपका एक पार्ट B है. All are important. किसी को भी एक से ज़्यादा महत्व मत दो. क्लिनिकल सब्जेक्ट्स में आप बहुत अच्छे हो, राइट. सो क्लिनिकल सब्जेक्ट्स आप अच्छे से रिवाइज करो. इजी क्वेश्चंस, डिफिकल्ट क्वेश्चंस, एवरी क्वेश्चन यू शुड बी एबल टू सॉल्व. इन द मेडिकल ऑल्सो ट्राई एंड सॉल्व एवरीथिंग नाइसली. ठीक है, सब कुछ अच्छे से, एवरी पार्ट इज ऑलमोस्ट इक्वल एक्सेप्ट व्हेन यू गेट इनटू अ टाई पोजीशन. फाइन, बट अगर मेडिकल अच्छा आता है, डेंटल भी उतना अच्छा ही आना चाहिए. ओके, चलो. Then urinary copper, all this we have done. Fine. Treatment, everyone, is zinc acetate, or if there is hepatic, Dr. Saurabh, that is an individual choice बेटे. ठीक है, अगर मैं हूँ suppose and I want to be fresh in mind, then I'll start with A, है ना, because the mind is fresh. जो क्लिनिकल्स होते हैं, बट दैट इज़ एन इंडिविजुअल चॉइस. आई लीव इट अप टू यू. ठीक है, कोई इसका हार्ड फास्ट फॉर्मूला नहीं है कि क्या करेंगे. इट इज़ अबाउट कि भाई जब आप फ्रेश हो तो आप क्या करना चाहते हो. एंड एट द सेम टाइम इफ़ यू आर कॉन्फिडेंट इन समथिंग, यू वांट टू अटेम्प्ट इट फर्स्ट, ओके, अप टू यू. सो इट्स एन इंडिविजुअल चॉइस. आप डिसाइड करो क्या करना है. ठीक है. नेक्स्ट, if there is hepatic decompensation, we use zinc acetate and a chelator D-penicillamine. Neurological symptoms, tetrathiomolybdate, ये नहीं आया है आज तक. zinc acetate ही आता है. So know this. Right? Score पे आया है question. Score which is used for Wilson's is Nazar's index. Done everyone? Okay, very good. So we finish Wilson's.